Assalamu alaikum everyone, and welcome back to my YouTube channel. If you are new to my channel, then subscribe to it and press the bell icon for the latest updates. Without wasting your time, let's start. Today, I will start another topic that is drug acting on gastrointestinal tract, simply known as GIT. Before discussing, we should know about what is gastrointestinal tract and gastrointestinal tract drugs. The gastrointestinal tract is part of the digestive system. But here the question is that what is digestive system? The human digestive system consists of the gastrointestinal tract plus the accessory organs of digestion. Digestion involves the breakdown of food into smaller and smaller components, until they can be absorbed and assimilated into the body. Gastrointestinal tract drugs that is used to treat gastrointestinal tract problems. Now I will discuss the drug that is used as aluminium hydroxide. Origin. It is a naturally occurring mineral, an antacid. It is used to treat symptoms of increased stomach acid, such as heartburn, upset stomach, sour stomach, or acid indigestion, and also used to reduce phosphate levels in people with certain kidney conditions. Dosage forms of aluminium hydroxide. Mostly in syrups. Suspension. Mechanism of action of aluminium hydroxide. The drug neutralizes hydrochloride in stomach to form aluminium chloride in water. Indication. Used in acidity. The side effects of aluminium hydroxide are constipation, discoloration of feces, stomach cramp. Drug interaction. Don't use with citrate or citric acid, can increase the absorption of aluminum hydroxide. This may lead to elevated blood levels of aluminum, particularly in individuals with reduced kidney function, since aluminum is primarily eliminated by the kidneys. Sometimes it weak the bone. Don't use with ascorbic acid. Vitamin C can increase the absorption of aluminum hydroxide and cause toxicity. Warnings and contraindications. Contraindicated in patients with hypersensitivity to aluminum salts or any component of the formulation. Aluminum toxicity may occur in renal impairment. Use with caution in patients with heart failure, edema, and cirrhosis. Elderly patients are predisposed to fecal impaction. Use with caution in people with recent massive GI hemorrhage. General considerations. Advise the patient taken 1 to 3 hours after meals. Advise the patient if his phosphorus level is decreasing, drug taken after 20 minutes. Monitoring parameters or tests of aluminum hydroxide. Monitor calcium and phosphorus levels periodically if patient is on chronic therapy. Buffer capacity is to be calculated in ulcer treatment. Commonly prescribed brands. Syrup. Mucane. Syrup. Digex MP. Syrup Gaviscon. Dose. 2 TSF 3 to 4 times a day. If you enjoy this video is informative, then like, share and comment, and any question about this topic you can ask in comment section, and give me any suggestion about my lectures and follow on LinkedIn. The link is in description section. Thanks for watching.